Hello everyone, welcome to sqadia.com. I'm Hamna Iftikhar and today we'd be studying about gastroesophageal reflux disease. This topic is being divided into 5 sections. The first section that we'll be studying about is the pathogenesis of GERD. We'll be studying about the anti-reflux barriers and the main mechanism of a reflux. Then we'll be studying about esophageal acid clearance and the gastric factors that affect the reflux. In the second topic, we'll be studying about the clinical features and the related diseases. We'll be studying about the classical symptoms in a patient, the extra-esophageal manifestations and differential diagnosis and the associated diseases. In the third topic, we'll be studying about the diagnosis of GERD, the empirical triad of acid suppression, endoscopy, and esophageal reflux testing. And in the fourth topic, we'll be studying about the clinical courses of the complication, erosive disease, non-erosive disease, and different complications related to GERD. And finally, in the fifth topic, we'll be studying about the treatment of GERD, the lifestyle modifications, the treatment with medicines, and treatment with surgery. I hope you'll be enjoying the lectures, and please keep watching the other sections related to this topic.